It is 10 o'clock.
Mm-hmm.
Good morning, everybody. I think we can start. It is already 10 o'clock. Are we ready to start? I don't want to delay people. So, good morning, everybody. And I'm going to go straight to the event. I would like to welcome every one of us. There seems to be some reflection. Are you all hearing me?
Yes, we can hear you now, Fatima. There was a bit of rebound, but we can hear you now. So please go ahead.
Okay. Thank you very much, everybody. Good morning. You're welcome to our webinar, and this is a webinar organized by Medical Aid Film, Nana Girls in UK, London, and Nana Girls and Women Empowerment Initiative. And this is an outcome of a project funded by Global Health Program, TED, formerly in UK, and managed by Ducit Blue here in Nigeria. You are most welcome. And as you are aware, the project is about digitalizing nursing education. It was a 1.5 years project, and we would like to share our experience, as well as we invited others to also share their experiences about digitalizing nursing education. We've worked with 7 colleges of nursing and midwifery across the country, and I'm sure the leadership of those colleges are here with us. And they are across the country, from Yobe, from Akwa Ibom College of Nursing, from School of Midwifery in UCH Ibadan, to College of Nursing Mina, College of Nursing Sokoto, College of Nursing Kano, and Abia College of Midwifery. So these were our partners, and of course, one of the key partners, actually we are 4, is the college, the Nursing and Midwifery Council of Nigeria. So this is a brief background, and I would like to invite, and we have some speakers lined up for us, and of course we have the registrar of Nursing and Midwifery Council of Nigeria, who have been very supportive of our work. As partners, we've been partners for a long time. We also have Ms. Estelle, who is the founder and director of Ducit Blue, who is also going to give us some goodwill message. And we have presentation from Aliyu Adamu, who is the ICT manager of Nana Girls Women Empowerment Initiative. And we're going to share a film with you by Helen, by the Medical Aid film. So we're going to have experiences from eHealth, who have done similar work in Nigeria, and also from Team Seal, who had similar experience in UK. So please sit, and we also have Adenike, who is also going to share the global health tech experience across Africa. So sit down and wait, and after that, we're going to have some questions and answer sessions. And please, if you have questions, please put it and we'll read it out. And we would like, if questions are asked that are relevant to the colleges, we're going to invite the provost of the colleges to respond to those questions rather than us, because they have been the one implementing. So with these few remarks of mine, I would like to go straight to the to the goodwill messages, and I would like to invite our OGA, the Registrar of Nursing and Midwifery Council of Nigeria, to give us a goodwill message. And as I've said, I've made introduction to in Mr. Indagi Alasan, the registrar, who had been part of this struggle, and the need to digitalize our nursing and bring reform in the nursing profession. He has been part of this initiative, and I would like to welcome the registrar. Please give us your closing remarks. Thank you. Well, your goodwill message. Thank you. Over to the registrar.
Thank you, Dr. Fatima Adamu, for the well-detailed introduction of the whole process and the participants in this meeting. It is Ellen. Good morning.
Good morning.
How are you?
I'm very well, thank you.
We cannot thank you enough. Dr. Awol, I can see you, other members behind the scene. Good morning, everybody.
Good morning, sir.
It is a goodwill message, but because of the passion and the happiness, joy in me, I try to make it a little bit of full speech. As brief as it might look, it is concise. I want to speak to the gains of the projects that we collaborated with and the impact it has played or initiated in our developmental trend. Let me start by welcoming the ED Nanages and Women Empowerment Initiatives, distinguished guests, ladies and gentlemen. It is with great pleasure and honor that I address you all at this remarkable event, marking the conclusion of the project titled Enhancing Teaching and Learning through Digital Resources Creation and Mainstreaming of Gender Equality and Social Inclusion in Colleges of Nursing Sciences in Nigeria. I extend my heartfelt congratulations to the Nanages and Women Empowerment Initiative for their dedication to this project, which has been generously funded by UK under the fund management of Tropical Health and Education Trust, TET. The past 1 year has been one of growth, innovation, and empowerment. This project has not only equipped students and lecturers in our colleges of nursing sciences with essential skills to develop digital teaching resources, but has also enlightened us on the importance of gender equity and social inclusion. These achievements underscore the need for a more inclusive and equitable educational environment, which is fundamental to achieving excellence in nursing and midwifery education. Digital empowerment in our nursing education. In today's world, technology is an indispensable tool in education, and nursing education is no exception. By equipping students and lecturers with the skills to create and utilize digital teaching resources, this project has bridged a significant gap in our approach to teaching and learning. These resources not only enhance the learning experience, but also prepare our future nurses and midwives to meet the demands of increasingly digital healthcare system. The innovative approach taken by the Nanages and Women Empowerment Initiative has set a precedent that I encourage all nursing institutions in Nigeria to emulate. The integration of technology into our curricula is no longer a luxury, but a necessity. Gender equity and social inclusiveness. This project has also brought to the forefront the critical importance of mainstreaming gender equity and social inclusion. JESI is more than a concept. It is a commitment to creating an environment where everyone, regardless of gender, ability, socioeconomic status, or background, has an equal opportunity to succeed. The awareness creation about gender equity and social inclusiveness has sown seeds of change within our educational institutions to develop a culture of respect, inclusivity, and equity. Social values are essential not only for our classrooms, but also for the communities our students and graduates will serve. It is imperative that we continue to support and strengthen this aspect of our healthcare system, as it is key to achieving universal health coverage and addressing critical issues such as the maternal and child health indices in Nigeria. This is a call to action. I urge you to continue supporting and recruiting these licensed community nurses and midwives within our community. Your leadership is crucial in ensuring that the community nurses and midwives are absorbed within our community to bring down this maternal and child mortality, which is mostly domiciled in the country. To the provosts, lecturers, and students, I encourage you to take full ownership of the skills and knowledge gained. Use them to create transformative learning experiences to inspire others, and to be advocate for inclusivity in your institutions and beyond. To Nana Girls and Women Empowerment Initiative, Tate and UKAID, we extend our deepest gratitude for your vision, commitment, and investment in the future of nursing and midwifery education in Nigeria. Your work will undoubtedly leave a lasting impact. Finally, let us remember that this event is not just about celebrating the conclusion of a project, but about recognizing the beginning of a journey towards a more inclusive, equitable, and technologically inclined nursing education system. Together, we can build on this momentum and create a brighter future for nursing and midwifery education and practice in Nigeria. The Council is very grateful to Nana Girls and Women Empowerment Initiatives and Medical Aid Films UK for adding a brand new MCPDV modules to our reservoir, Student-Centered Learning 2. This will be rolled out for implementation, and the new MCPDV facilitators will be given further orientation during the forthcoming orientation workshop. Thank you, and may we continue to work together for betterment of our profession and the health of our nation. Thank you very much. This is the brief. It is my goodwill message, but I have taken you a little time that I have to express my happiness and joy over your support. The transformation you have brought into nursing education cannot be quantified. We have started well, and by the special grace of God, this will extend. We would make it a national project and extend it over to all other institutions. Thank you.
Thank you. Fantastic. That is good to hear. Thank you very much, the registrar. Thank you. This is music in my ears, and I'm sure in the ears of all of us, the funders and everybody. Can I invite the funders, Ms. Isele, to please give our goodwill message?
Good morning.
Good morning.
Hope you can hear me.
Good morning.
Yes.
Great. Good morning, everyone. Thank you so much, our registrar. It's a great honor to go after such an amazing celebratory goodwill message. So good morning, distinguished ladies and gentlemen. My name is Estelle Mbadiwe. I'm the founder of Ducit Blue Solutions. I just want to say congratulations to the team. This is a project that we followed very closely from the inception, and it's really been amazing. And to hear the registrar say that it's going to go, embedded in a national program, it's definitely music to my ears as well. So permit me to stand on established protocols and express my sincere appreciation for the opportunity to speak at this timely and vital convening. Across the globe, we know that health workforce is the backbone of resilient health systems. Unfortunately, we face a projected shortfall of about 11.1 million health workers by 2030, which disproportionately affects low middle income countries and sub-Saharan Africa, which has the 25 disease global burden, has about 3% of the health workforce. So in Nigeria, as we know, we have about 220 million people approximately, but we fall short of the WHO benchmark of 4.45 health workers per 1,000 population. The statistics are there, but behind the statistic lies some systemic issues. We have some outdated curricula. We have limited faculty in Nigeria. We have a lot of migration happening, with health workers and key expertise leaving the country, as we call it JAPA in Nigeria, and gaps in this digital readiness that leave many graduates underprepared for a modern and digital health sector. But there is hope. Through the initiatives like the Global Health Workforce Program, which of course at Ducit Blue Solutions, we're proud to be coordinating locally, and the GHP managing globally. We have partnerships that are merging with Regulatory Council, has been clearly evident with the registrar, and training institutions across the country to support this digital uptake. And we need to look at this in terms of ensuring sustainability. We need to also say that, mention the huge support and the fact that this has been well integrated with the key national mechanisms, including the Federal Ministry of Health, which has been a big part of this program as well. So for example, we have the REACH project. You hear much more about that later. And of course, the amazing work that today's hosts are doing with the LG83 team. Congratulations once again, who have trained many faculties and health workers on digital tools for learning so that innovation is really taking root, from e-curricula to virtual simulations to digital mentorship and faculty training. These efforts are building that foundation that we truly need for a digital empowered workforce and expanding access to quality education, including taking GESI into consideration. So today's discussion is not just timely, it's not a tick box exercise by any means, it is critical. It challenges us to bridge that gap between tradition and transformation. If we truly embrace this digital innovation boldly and inclusively, we can truly empower a new generation of nurses and midwives and other healthcare professionals who are skilled, confident, and definitely future ready. As our famous Florence Nightingale wisely said, let us never consider ourselves finished nurses. We must be learning all of our lives. And this is a call for myself as well. Continuous professional education and learning is really critical. And I want to also add, a very famous quote by Nelson Mandela, which is one of my favorites when we start these initiatives. It always seems impossible until it's done. And the team have done it and have done it excellently. So congratulations. So let this be a call to action to reimagine pre-service education, not just as it is right now, but as it must be, to deliver health for all in every corner of Nigeria, to move us from dialogue and talking to implementation, and from pilot to scaling across the country and beyond, like the registrars hugely supported that initiative. So I just want to thank you all, and I wish you productive deliberations and continue to spark real and lasting impact like you've done. Thank you, and a huge congratulations to the team once again. Thank you. Over.
Thank you very much. Thank you very much. That's our founder. I will thank you because of time. I will just go straight and invite Aliyu Adamu to share some brief a bit about what we've done, trying to digitalize the nursing. Over to you, Aliyu.
Thank you.
Who's raising his hand? Aliyu, please. Yeah.
Okay. Good morning once again. Permit me to stand on the existing protocol. My name is Aliyu Adamu. I'm the project coordinator for the LG83 project. And my part is to introduce you to the project and also share with you our learnings. So next slide, please. So the outline is we're going to look at the project background, the approach we took as partners to get to where we are, and the key learnings from the project, the impact we have made, and what are our next steps. Next slide, please. So the partners, the project is a partnership between Nana Girls and Women Empowerment Initiative, which is the lead partner. Then the co-lead partner is Medical Aid Films Limited in UK. Then we have Usmanu Danfodiyo University, Sokoto, UDUS, and Nursing Midwifery Council of Nigeria. As 4 partners. Our funder is UK Department of Health and Social Care, and our fund and grant managers are Global Health Partnership, formerly TED, and Ducit Blue Solutions. Next slide, please. Yeah, so let's start with the project background. Globally, we know that digital learning improves engagement, self-direction learning, and that's why as a project, we look at how we can improve that. You know, for instance, in sub-Saharan African, we face persistent divide affecting health education, and the barrier, of course, is limited infrastructure, lack of institutional support, and low digital literacy. For instance, in terms of the low digital literacy, we did a competency needs assessment in one of a US FODNet project, where 16 institutions, 268 lecturers, and 16 leaders, regulators, and unions were engaged. And we found that 80% of our lecturers have strong in subject knowledge, but huge gap in digital teaching skills. Next slide, please. So with this obvious gap, our aim as a project is to support the colleges with structures that will help them to continue creating digital resources even beyond this project. And we are going to do that in partnership with all the stakeholders, as I will explain further. The target initially is to train 50 lecturers in 6 institutions. But interestingly, we ended up training more than 500 lecturers across more than 70 institutions. Of course, with the support of Nursing and Midwifery Council, and also GHP, which is formerly our fund managers. The strategy we use in the capacity building is a blended learning, which is a combination of in-person workshop. We conducted a week-long training of the trainers workshop. We have the online modules that they can use to reference what they learn, and there was technical support across the period. Next, please. So, yes. So let me just take us through quickly our approach. The first one was we engaged the stakeholders and we conducted a baseline needs assessment. We also procured the equipment we need, and since we are partners, we have to develop some critical policies that will guide us in implementing this project. And it's at this stage, the stakeholder engagement, that when we brought up the plan, NMCN requested that because of they really love what we are proposing, they requested that we expand the number of colleges from the initial 6 to about 70, and also expand the number of lecturers to be trained from 50 to more than 500. And we're able to achieve that because we have a very flexible fund managers, and also NMCN was able to liaise with the colleges to co-fund the training. So the colleges and NMCN provided supported the lecturers that were trained with transportation and accommodation, while we provided the expertise to train them and also the logistics, which involved the feeding and the hall. And the training was successful. The training was done the master training was done in Abuja and then cascaded down to the zonal level. For the next step, which is co-develop the curriculum and toolkit, this one too was done in partnership with NMCN. And this was shaped from the baseline assessment we conducted, where majority of the students prefer to their digital resources to be in a video format, while the lecturers, majority of them wanted to be trained on how to create PowerPoints and then afterwards videos. And this really shaped our curriculum, where lecturers were trained on how to create videos, how to edit videos, how to create PowerPoints, and also how to make content interactive. Importantly, we also ensure that lecturers were encouraged to create videos or content from the curriculum where they identify areas that are difficult or abstract, so that at the end of the day, we'll create digital resources that is interesting, fun, and easy to learn. After the curriculum was developed, we had master trainers were selected across the 6 geopolitical zones and were trained on how to create digital resources. This was facilitated by Medical Aid Films Limited in collaboration with Nana Girls Women Empowerment Initiative and UDUS. NMCN was fully involved, and it was a successful training. The training Abuja down to the zonal level, and that is where
Ali, your time. I don't know who is giving you warning, but I'm concerned about your time. Yeah.
Okay. So okay. So how much time do I have?
You have probably 3 minutes. So.
Okay.
But continue. Take note of time.
Good. Yeah. Okay. So we had zonal training was conducted across the country, and after the training, of course, we provided the infrastructure. We supported the colleges with infrastructure that lecturers can go and create the digital resources, such as audio devices, video devices, lighting at the studio. We created a studio for every college that was supported. The 7 colleges supported, so that the lecturers will have a conducive environment to create digital resources. The last stage was all about, ensuring that the colleges have structures that will ensure digital resource creation continues even beyond the project. Training and retraining of lecturers, and of course the reward and motivation committee, which motivate lecturers to continue producing digital resources. Next slide, please. So the key learnings, that is what we're going to look at. The first one is, of course, stakeholder engagement, and as you can rightly see, strong stakeholder ownership drives sustainability. We've heard from the registrar where he's mentioned that he wants this project to be national, And I'm sure this is as a result of a strong stakeholder ownership. The colleges were very supportive. You know, as I mentioned earlier, there was co-funding, the zonal coordinators, because as a project, as you all know, our initial plan is to train just 50 lecturers, and that's how our resources, that's the limitation we have with the resource. But the zonal coordinators were involved. NMCN involved their zonal coordinators to help us not only ensure the training of more than 500 lecturers, but also to monitor the creation and use of digital resources across the zones. Next slide, please. The co-development and participation management box. As I'm sure in a few minutes, we are going to watch the film developed by Medical Aid Films. So, and Usmanu Danfodiyo was involved in was handling the research component of this project. So all the partners brought one unique expertise, which in combination were able to achieve what we achieved. Can we go to the next slide, please? Yes, one of training, this is another lesson we learned. One of training is insufficient. Continuous support is essential. We successfully conducted training of master trainers, did the zonal training, and at the zonal level, the colleges that attended the zonal level were encouraged to go back to their colleges and train the lecturers at their colleges. So, but despite that, we have remote clinics where we provide technical support through WhatsApp groups, and we have peer mentoring strategy, which was handled by the capacity building committees we establish across the colleges. They ensure that lecturers are being paired to support each other. Next slide, please. Infrastructure and logistics matter as much as training. Yes, we are talking about digital skills here. So after the training, lecturers must have the equipment, the environments must be conducive for them to continue creating digital resources. For instance, as you can see, this is one of the colleges we supported in Abia State. The lecturers were being oriented on how to create digital resources, videos using the studio equipments we supply. Next slide, please. So, of course, clear governance and quality assurance frameworks institutionalize change. Currently, we have a plan with NMCN, Northern Midwifery Council of Nigeria, to not only have these various committees at the college level, but also to have them nationally. We are going to have a quality assurance committee at the national level, and also the reward and recognition committee, where lecturers and colleges will be rewarded for creating digital resources and use. And also the quality assurance at the national level will ensure that content created have met the standard of the nursing practice. Next, please. So this is the impact so far. 34 trainings conducted, 506 lecturers trained, and about 3,117 students trained on how to use digital resources. The lecturers so far have created more than 249 different digital resources and shared with the students for use. And as part of the project, we have mainstream JC across the institutions we are supporting, where 36 staff trained on how to mainstream JC. We also developed action plan to help them ensure that JC mainstreaming is successful. Next slide, please. So next steps, what are we going to do after now? For local partners, we'll continue collaborating with Nursing and Midwifery Council of Nigeria and the college management to provide technical support to the established committees after the project ends, because we are around, we are with them, we are part of the WhatsApp group they created, and we'll continue providing that support beyond. The partnership is working with NMCN to scale the learning management system adoption by establishing national level quality assurance and reward recognition committees. We are also working with NMCN to ensure that this project is scaled up nationally, where all the, I think about 200 plus colleges across the country be trained on how to create digital resources for teaching and learning. The partnership intends to co-fund maintenance of the online learning management system to enable NMCM and local partners to engage more schools and provide monitoring and technical support to both existing and new institutions. We are going to have we already have an online management system which will be maintained to ensure that lecturers continue supporting we continue supporting lecturers to the institution. Next slide, please.
Wait, there's still more slide? Ooh.
The partnership will continue working with NMCN to mobilize additional donor funding to expand the creation and use of digital resources across colleges nationwide. And currently, as I speak to you, are in Abuja developing how to guide so that we continue supporting prospective colleges on integrating digital resources creation into their traditional teaching and learning. Thank you.
Thank you very much. Thank you very much, Aliyu. And I will go straight and invite Helen to share the film, and over to Helen. We're really working.
Great. Thank you very much,
schedule.
Fatima.
Yeah.
Thank you, Fatima, and thank you, Aliyu, and good morning, everyone. I'm Helen Coombe. I'm Head of Research and Learning and I bring greetings from Medical Aid Films. We've been very excited to be one of the partners on this Global Health Workforce project that Aliyu has just been presenting on, harnessing the potential of digital technology to enhance student learning and engagement, but also supporting lecturers and their institutions to develop their capacity around digital resources, education and technology. And it's been a tremendous privilege for us to work with Nana Girls and Women Empowerment Initiative, Usmanu Danfodiyo University Sokoto, and with the Nursing and Midwifery Council of Nigeria to develop the training curriculum and the module for the mandatory program of continued professional development. And as Ali has mentioned, it's a partnership that we're all hoping to continue to another phase of collaboration. So I'm delighted to launch our short film that we produced about the project, it's called Educating Nigeria's Nurses and Midwives in a Digital Age. The film brings to life the impact of the project through the experiences of a wonderful lecturer, Ms. Taiwo Dosumo, and her very impressive students, as she shares how participation in the project has impacted her skills and her teaching. And we would really like to thank Ms. Dosumo and the students and the colleagues at Bowen University College of Health Sciences, along with students from SAJO and FTC colleges of Nursing Sciences in Birnin Kebbi and Gwagwalada, for all your contributions for helping to make the film, as well as Canby Pictures and Skylight Media for their location filming. So the film can be watched on Medical Aid Films YouTube channel. I'll put a link in the chat shortly so you can watch it there again. And it is also available to share widely. I hope you enjoy the film, and thank you.
In 2024, nurse and midwife lecturers from across Nigeria took part in training to create and use digital resources in their teaching. This Training of Trainers project is part of a global health workforce program funded by the UK Department of Health and Social Care, managed by Global Health Partnerships and run by the Nana Girls and Women Empowerment Initiative, Medical Aid Films, and the University of Usmanu Danfodiyo, Sokoto, in partnership with the Nursing and Midwifery Council of Nigeria. Among the delegates was Taiwo Dosumu, a lecturer at the College of Health Sciences in Bowen State University.
My area of specialization is maternal and child health nursing. I'm so passionate about maternal and child health, and that prompted me to train as a nurse midwife. And I see it as an honor to train future nurses. It was a privilege for me last year to be trained by TEDs on creating and utilizing digital resources.
We need to make teaching more engaging, effective, and more interactive. That is why the Nursing and Midwifery Council of Nigeria was very excited at the opportunity to work with TEFT and its partners, such as the Medical Aid Film UK, in order to develop this project.
Before the training, we were not so exposed to modern and useful resources that could make teaching and learning more interactive and student-centered.
It's going to be useful to them in many ways. One of them is giving them the confidence in classroom.
We have created a trainer of trainers curriculum that helps lecturers develop very practical skills around creating and using digital resources.
All you need for filming is a simple camera phone.
It will make the teacher more student-friendly, and it will also build the confidence of the lecturers, and the student will love it.
It makes the lessons more during classes, makes it more interactive, and it increases our level of retention because of the visual, audio, and also the quizzes in between lectures.
Okay, I need more response. More response.
Using digital resources relies on power, and the project is addressing this by trialing solar-powered servers in several teaching schools, meaning that students can access their online libraries even when there are power or network failures.
Yes, the resource is actually very helpful, and it is helpful knowing that the contents that are present in these resources are always there to actually help me study and understand my lessons better.
So at the end of the session, as learners, you are expected to identify various formula for calculating drop rate.
The digital resources are always handy, like the libraries are in our hand. The moment you click on your phone, on your desktop, you can be able to outsource some of the resources from the academic database, formulate your lecture or not, give the info to the students, and then the student can access it either in their desktops or in their phones, or sometimes the mobile.
We will train them, and they will go and cascade the training into other colleges in their different zones.
It has improved my use of technology. Nowadays, if I go on my phone, I don't only use my phone for just social media purposes. I use it for educative purposes, which is also broadening my horizons and also making my parents proud.
I learned how to create videos for myself using CapCut, using the OBS studio, and to utilize this video in order to make my teaching and learning more flexible and dynamic. I've introduced the use of various surveys, Question Pro, Slido. I also have lecture notes with embedded videos, embedded pictures, images. Students look forward to learning at every point in time. There's better understanding of concepts being taught. Students are more interested to learn new things.
Even after we are being taught, we still get to practice some questions from these slides in between the lecture. This digital resource she's using actually combines the slide, the lecture notes, together with questions that we can use our phone to scan online, and also with video demonstration that makes it very comprehensive and understandable.
That goes beyond theory, helps you see a visible image of what you're being taught, which helps you understand better.
It has helped me so much. A student like me, I'm always online. and it has helped me like understand courses like anatomy, physiology, psychology, mental health. I can easily access my teacher's notes and audios and other things.
Technology, as in Usmanu, it doesn't care about who you are. As long as you have the resources, we will be able to benefit from it.
This project is very apt in the sense that we are in the digital era. As a provost of the college, it is significant. It's going to add value to the process of teaching for the teachers and the process of learning for the students, and in fact, holds for completing the credit hours of teaching as specified in the curriculum.
I want to learn more about digital resources and then do a step down, introduce my colleagues to this so that the wider society will benefit from this, and then nursing as a whole would change drastically for the good.
Through this transformative program, 465 lecturers have gained the skills to create and use digital resources effectively. 98% of the participants were satisfied with their training, and 100% reported increased confidence in using digital tools for teaching. 4,260 students have also accessed resources through their new e-libraries, with 81% reporting that the new digital resources have deepened their understanding of medical topics, and 77% feeling more engaged in their learning. This initiative aims to drive real change in nursing and midwifery teaching in Nigeria. Together, we are reshaping education for a digital age.
Fantastic. Fantastic. Okay, Helen, I can take over from there?
Yes, thank you, Fatima.
Thank you very much. This is beautiful. Thank you very much. You've had our experience so far, and we want to go beyond our own experience to also share national and global experience. So I'm going to invite Dr. David from eHealth, who had been dominating the health technology in Nigeria, to share their experience with us. Dr. David?
I think Dr. David had a problem joining. So I think for the moment, can we just move to Tim, and then we'll see if Dr. David can join later.
Okay. Yeah, that's good. So, Tim, let's move to the global experience. Tim Seal from London School of Hygiene and Tropical Medicine. Over to you. He's going to share slides, is it? Or what?
1 second, Tim, you're just on mute.
Still on mute.
Right, yeah, I think I've been moved to an attendee rather than a presenter somehow. So I don't know if you can see my video as well. I don't have any slides, so I was just going to present.
Okay.
Okay. We can see you. Yeah, and also hear you.
Okay, all right.
Good.
Well, thank you, everybody. And yes, thank you, Fatima. And yes, I said, my name's Tim Seal. And I worked with Nana and Medical Aid Films in developing the curriculum for the content you just saw in the video. So I've been working in the area of kind of digital technologies in education for over 25 years, and that is from working on very simple kind of initiatives to setting up kind of large scale cutting edge interactive studios, developing science centers in medical laboratories, all sorts of things. So I've got kind of a wide breadth of experience, and a lot of that time has been working at the Open University, particularly in low and middle income countries, supporting education institutions, governments, multilateral organisations in kind of development of educational strategy and practice. But also in health systems, working with frontline health workers and the use of digital technologies to support practice in that area. And as Fatima said, I'm now with the London School of Hygiene and Tropical Medicine, where I lead the digital learning team as part of their Centre for Excellence in Learning and Teaching. So I was asked to talk briefly about some of the challenges, or the main challenges in digital technology in education, and some of the ways that we've tackled those, or some interesting approaches to take, particularly for medical education. But it really does, you know, what I'm going to talk about really sits within the educational context more broadly. So I just really wanted to start by highlighting that kind of at the top level, the challenges that you may face within this particular field can be broadly categorized within two areas, and that is around access and literacy. Yeah. So when you combine these things together, they can be referred to in the literature as digital poverty, which is not about economics, but more about these kind of digital literacy and access and how that affects you, both from a socioeconomic perspective, but also from a pedagogic and learning perspective. There is a sort of third issue as well, but I will pick up on that later. But those are the two that I wanted to focus on now. So when I talk about access, that fits into kind of three sort of domains. So the big one that we all think about with access is technical access. So can you get online? Do you have the right hardware? Do you have consistent power, or any power to power devices that you have? Are you able to use this? Do you have access to the right sort of software? You know, is it an economic barrier? Can you afford the software? So actually being able to engage in the digital world, you know, from a kind of very physical, technical access point of view. Then access also looks at notions of accessibility. So in the form of enabling access, so forms of engagement. So for example, if all the other aforementioned kind of access issues are solved, actually you still having problems accessing because the way in which you need the information delivered to you is not being delivered in the right way. So for example, if you had a visual or auditory impairment and you were being provided with a video, actually if there's no transcript or no subtitles, it will make it very hard for you to access that content. Or if you have particular assistive technologies and the content isn't provided to you in the right particular formats, you might not be able to engage with it. Or if cognitively the content isn't set out in the right way and engaged in the right way, it becomes very difficult for you to engage with it. And then the third kind of idea around access and the challenge of access to digital education is around open and closed content. So I'm sure that lots of people in the room will have had this experience where they want to view something, maybe a particular piece of literature, but they have to pay to subscribe to a publisher to be able to access that content. Or the particular course sits behind a paywall and you have to actually pay money to get access to that content. Or you need to be of a certain group or particular membership to be able to access that content. So the content is closed in itself and it forms more barriers. So access is a really big challenge when we think about digital education and digital technology. You know, the dream is great and that it's there and it provides lots of access, but actually it also provides lots of enables lots of barriers as well. So one of the key things is that we don't, when we're producing when we're using digital technology in education, we don't want to reinforce those barriers that exist anyway, and we don't want to create any new ones. So the other element around this is literacy, and of course we mean digital literacy here, but literacy itself, you know, more broadly is a barrier and probably sits within the access domain. But when we talk about digital literacy, you know, this is about not having the tools or the knowledge to be able to engage in the digital world. So, for example, and these are all real challenges we've come across, you may not know what the internet is. Or you may not know how to use a mouse, or you may only have a mobile phone for accessing the internet and you see Facebook as the internet. You may not know how to create a PowerPoint or any other type of media content. You can't save or share documents online. You don't understand the tools to work collaboratively and what that means. And you don't understand what you can and can't share online, like pieces of thoughts around digital security and staying safe online. So you can very quickly become kind of endangered in these spaces. So like I say, I mean, all of these are kind of real issues that we've had to tackle and address. And just to say, it's really helpful to think about this in terms of these two broad areas, in terms of access and digital literacy, because that helps you to think about how you can address them, but equally where you may or may not have more control. So areas of digital literacy, you can start to see where you might have more control in those, or where you need to work with others to help support that. And particularly access, particularly around provision of hardware and technology, there are some of those things that you may have control in, some where you don't. So it's really good to kind of think about it in these two broad ways. So yes, I said there was a third issue. And it's kind of a digital literacy issue, but it's worth picking it up separately, particularly when we're thinking about supporting teaching staff and their professional development. And it's kind of in some ways quite unique to digital technologies. And that is because there's a bit more of a level playing field with digital technologies when you think about students and staff. And in fact, actually, it's probably one of the areas where you may come across that students actually know a lot more than staff around the use of digital technologies. And so that can kind of affect the dynamic of the student-teacher relationship and notions of professionalism. So particularly in contexts where there's a kind of hierarchical relationship with knowledge, if the students are knowing more and expecting more of the teachers, and the teachers don't have that knowledge, you kind of create this different dynamic that needs to be addressed. So there's some of the kind of, broadly speaking, there's kind of the top level challenges, if you like. And again, I know I don't have much time. I think I might be out of time already, but just really briefly to think about some of the ways that we've kind of tackled some of those things. So, when we think about access, really working to identify the problem. So one of the big things quite often is about being online. So, we've worked to provide offline solutions or online offline solutions. So students can start to work. They're not reliant on the internet. They're not relying on having that connectivity, that you can have kind of offline connectivity in the classroom where students can kind of interact with something online. But then at some point when there is connectivity, that can actually update content. So you're thinking about how you can start to use those kind of elements. Access to technology, where the issue is making sure that delivery works across multiple formats. So actually, if you know that most of your students use a mobile phone, making sure that your content that you deliver or your teaching is really accessible and works well on small screens. Again, supporting inclusive practices, developing courses on understanding how you can develop approaches, building in accessibility into your materials. So from very simple things of heading levels where screen readers can read your content, to kind of more dynamic pieces where you can think about alternative approaches, alternative formats to support students. And that's just really thinking about the content you're producing. There's a whole kind of element of using the digital technologies around your pedagogic approach. And I think I probably have to finish up now, don't I? But just to quickly say about digital literacy, there's a whole load of different things you can do there, which you can see that NANA and Medical Aid Films have worked on in addressing digital literacies. But also just to think about digital literacy frameworks. There are hundreds out there. There are lots of different frameworks out there, and it's worthwhile going out and looking and finding out what works for you. So there are multilateral frameworks from organizations such as UNESCO. You have digital frameworks from supporting kind of adjunct to government. So in the UK, GISC, or the Association for Learning Technologies. But in Nigeria as well, the government has also released their NDLF, so National Digital Literacy Framework. So being able to understand what does that framework look like, and how are you meeting those challenges using those digital technologies. So it's a really key element. And again, probably just to finish off on that third issue about the imbalance of, between staff and students, we've worked quite extensively in that focus point, and really it's about supporting staff to think a bit more widely about kind of a collaborative working with students. So thinking about students as co-creators of knowledge, helping the students to kind of have a more dynamic relationship with the teachers, and using the students to understand what is the best way for you to share knowledge and content with them using the digital technologies that they have available to them. That was very rushed. I can go into much more depth on any of those, but I think I'm probably out of time. Is that right, Fatima?
Yes.
Okay, well, look, thank you, everybody. I hope there was something you got from that, and I'm happy to answer more questions at the end.
Yeah, absolutely. Especially the dynamic between the student and the lecturer, that we found also interesting. Thank you very much. Really thanks for sharing your global experience, and I'm mindful of time, but we're not doing bad with the David is not still with us. If it's not,
no,
then
he hasn't arrived yet. No, I'm sorry.
Yeah. Okay, then that's fine. We're doing well with time if that's the case. So can I please invite Adenike to share the regional experience? We wanted the national, regional, and then global. So, but unfortunately, we didn't get the national one. But then you've heard from us. Ms. Adenike, over to you. Are you with us?
Yes.
Thank you.
Good morning, everyone.
Good morning.
Adenike Badira. I'm a consultant grant manager working with Global Health Partnerships and Ducit Blue Solutions in Nigeria on the Global Health Workforce Program. So I'm bringing lessons from digital health interventions across Ghana, Kenya, and Nigeria. Next slide, please. So the content of my presentation is looking at snapshots of digital technologies that are currently existing in Ghana, Kenya, Nigeria, and I'll also highlight 3 of our interventions in the countries where we're working. Next slide, please. So just like any other interventions on digital health solutions, we've seen the use of the mobile health apps, the SMS-based interventions, telemedicine, electronic health records, health information systems, across these 3 countries, and also the use of the wearables and the personalized medicines, most especially for Nigeria. And we've seen all these solutions, contributing to improved access to healthcare, improvement in data management, and also strengthening health service delivery. So next slide, please. I think we'll jump, because of time, let's jump to the slide 7. Yeah. Slide 7. Next slide, next slide. The cross-country lessons will be brought. Please go back one step. The cross-country lessons will be discussed at the end of this presentation. Next slide. So on the Global Health Workforce Program, we have 41 health workforce interventions that we're implementing across Ghana, Kenya, and Nigeria, and 23 out of them have digital components. And this has included the use of digital tools and web platforms for healthcare workforce trainings and also capacity building programs. So we've built capacities of healthcare workforce to actually use some of these digital tools and to improve service delivery and also expand access to care. Next slide. So I'll be highlighting 3 of our digital health interventions. The first one is training of primary healthcare workforce and pre-service healthcare trainees on remote consultation using the training platforms in Ghana and also in Nigeria. The Nigeria sites are in University of Ibadan and also in Kano. And we also have the expanding capacity building of pre-service healthcare workforce using digital resources and tools. So this is the project that's actually organized this webinar. We've had about their work, so I won't be dwelling on that. The third one I'll also be highlighting is an AI-driven continuing capacity building e-learning platform for community health promoters in Tarakanti County in Kenya. So next slide, please. So on the remote consultation for primary health care, the strategy that was employed in this intervention first was stakeholder engagement and partnership building, which was very key, to making sure that at least we have the project kick-started, and we have buy-in, both at national and subnational levels. So the training modules were developed and were made available on web platforms. Right on the screen, you can see a code, which if you scan it directly, to take you to these training platforms. And that's the beauty of access, that has been built into that particular intervention. So from your mobile phones, from your laptops, you can access the training on Google Play Store and Apple Store. And, this training was conducted for in-service healthcare workforce and also the pre-service students in medical colleges and also the schools of nursing and midwifery and colleges of health technology. So while this training was going on, they were also able to get CPD accreditation with the professional bodies. And as they were doing the training, as they are delivering remote consultation, they are also getting CPD points, which is an incentive that was built into the program for healthcare workforce. So they, in total, they were able to see that the remote consultation contributed to improve access to care, and then there was improved skill, especially among the pre-service education trainees. And we also saw increased healthcare coverage, from baseline of about 1,265 remote consultation, we saw an increase up to about 5,800 within 7 months of implementing the program. This particular intervention underscores the accessibility and also promoting equity and inclusion. So as long as you have the tools, irrespective of gender, you have access to digital health learning. Next slide. So we see that this is the health partnership that has already, delivered on their, that has already. Hello, please, can you hear me?
Yes.
Yes, we can hear you, yes.
Okay. Okay, so I won't dwell on this, but we've seen the results of the intervention from the Nana Guest and Medic 8 films, that they have presented their solutions to digital education for health workforce. So I will just move directly to the third case study, which is our health partnership in Kenya. Please go back. Our health partnership in Kenya, move forward, you've jumped. Yeah, thank you. So our health partnership in Kenya that built an AI-driven continuing capacity building e-learning platform for community health promoters. So, that platform provided an opportunity for the healthcare workforce working within communities to have access to medical information, that they could use in providing on-site treatment, so that at least cases that doesn't require referrals can be dealt with right within the community. And we also saw an increase in referrals for patients that need specialist care. Next slide. So, just like any other digital health solution, what we've seen in terms of challenges has been unreliable power and internet service supply, and also lack of digital literacy and usability issues among some of the healthcare workforce. And then there's this cross-functionality deficiency for some of the digital health platforms not connecting, not speaking to each other. So there's that isolation, of solutions across the different sectors of healthcare delivery. Then we also saw insufficient funding and financial constraint. Most of these solutions are donor dependent. Once donor funding ends, then, what next? And this has brought a lot of issues around sustainability. And we also saw issues around limited use of digital data for decision making. The last slide, I think, yeah. Please, next. So our lessons learned, and this also speaks to some of the recommendations that we might also be providing here. So first, we could see that, early and continuous stakeholders engagement is very critical. So that co-creation process, it's something that must be entrenched into all digital health solutions that we're providing, across all the health sector strata that we are trying to influence. Then leveraging on existing technology and its platforms, quite very cost effective. So it's something that we should always build in when we are planning such digital health solutions. Then also utilizing digital training approach has proved effective. We could see the example, from all the testimonies we saw from the students in the film that we have watched. And we could see that, digital training eliminates gender barriers to health learning. So flexibility is key, and it should be context specific. So, because if we have localization, then we'll be able to promote the use of the digital tools that we're introducing, and that will definitely enhance user experience. Also, engaging satellite-based internet service providers is key for us to have access, and also providing alternative power supply, especially for solar in this sub-Saharan Africa. We have the sun, we have the means of generating the power, and all this will mitigate some of the infrastructure challenges, that we see. And that is actually what we've deployed in the Global Health Workforce Program that has given us the kind of success we've recorded so far. Thank you very much. Thanks for listening.
Thank you very much. I know I'm pushing for us to have more time for questions and answer. I hope I've succeeded. We still have about 17 minutes, or let's say 15 minutes for this. So I'm opening up for questions. Please, do you have any questions either for the presenters or even for the colleges, because the leadership of the colleges, I assume they are with us here. Please feel free to ask any questions you want to ask. Anybody, there's somebody coordinating that, isn't it?
Yes, Fatima. So if I don't know if you can hear me, but there was the first question that we've had was, how can policymakers and regulatory bodies in Nigeria support the integration of digital tools into pre-service nursing and midwifery education beyond the project?
Who is going to answer that question? Is Nursing and Midwifery Council there? Maybe also Aliyu from his own experience, or any of the college leadership, because this is this is about sustainability. Who wants to answer the question? Should we read it again?
Yes, let me read that again.
Policymakers and regulatory bodies in Nigeria support the integration of digital tools into pre-service nursing and midwifery education beyond the project life cycle? That's the question. Who wants to take it on? Dr. Emmanuel. Yeah, please. I would love to hear from you on this question. Okay, are we giving Emmanuel, unmute Emmanuel to speak? Also, Tim also wants to speak. So we have two.
I don't know if you can hear me, but maybe while Dr. Emmanuel's microphone's being unmuted, I could just offer some reflections. I mean, I think that I don't have that experience, you know, in terms of the policy level that you're talking about, but I think definitely what I spoke about before around the use of frameworks and digital literacy frameworks, I think the support for those frameworks at any level is really key. So particularly if that's coming from policy and strategy, referencing those, they are embedded in, you know, they come from Nigerian government, so they are already signed up for and expected digital frameworks that can be utilized and referenced. So making sure that those frameworks are used with any kind of policy development, in any kind of strategic move or any kind of funding is a really kind of key element of how you can kind of move some of those things forward.
Thank you. Is Emmanuel with us? Up to now, we cannot unmute Emmanuel.
Emmanuel, you should. Yeah, you should. Emmanuel, you should be able to unmute yourself now. You are able to speak in the webinar, but I think it might be on mute your side.
Because we want to hear from the council, from the government. Okay. Obviously, we can hear from Emmanuel. Anybody wants to give a try, or we can move to the next question. Dr. Emmanuel, you can unmute yourself, but if you cannot, then we can move on. We have a question. What challenges did Nana team encounter and how were they addressed? Okay, Estelle wants to talk. Estelle, you please go. Are you on the first question?
Okay, yes. Now I was just going to just make a quick comment on that. Okay. Of course, in terms of sustainability, this project has been really embedded within the national mechanism from the start, the planning, execution, implementation, follow-up. So I think that is something that is definitely, you know, going to be really serve well in terms of sustainability of the project and the outcomes of the project, most importantly. And like the registrar said earlier, you know, the plan is to sort of look at how this can be pushing for national buy-in or uptake. So I think that's a good example and a good case study of how such projects should be implemented and driven from the onset, with the planning, with the ministry, the regulatory bodies, etc. So just to add that is something that definitely will serve it well, and is definitely a good case study to learn from for sure for other project implementation activities. So once again, congratulations on the process. Thank you, and over.
Thank you very much. Yeah, I wanted the council, but since we cannot, thank you very much for bringing it up. In fact, we were with the registrar. He was with us we're having a review meeting, and we're now discussing how they're going to continue monitor. Say they have set up a system, structures that they will continue implementing, scaling up to additional colleges, and we are there to provide all the necessary support needed. Okay, so there is a question about the challenges encountered in the implementation. I'm sure nothing is smooth, free, no challenge that we must have encountered. Who should I invite? I can invite, who? Is it Aliyu or? Whoever who wants to, or even from the minds, who wants to talk? Anybody? Catherine, is it possible to unmute you don't know them, so you can't unmute them.
I can unmute the participants.
Yeah, because I would like to hear from the management of the colleges, one or two of them, to share, to share some few words about the challenge and how they were able to manage it. I thought Ali will also say something, but I'm not hearing from Ali. Okay. Anybody who wants to share that? Helen, do you want to share anything?
Yeah, I mean, I think, gosh, the challenges, so I think there are two types of challenges. First, obviously, there was the infrastructure. And I think that the ability to have a learning management system available offline addressed some of those challenges. But I think it really required a core team who are within the institution who understood the infrastructure requirements and had the capacities to be able to manage that. So I think the challenges for many institutions is that they may not have the staff team and the experience of the staff team to be able to implement a project like this. So it's really important that when you're thinking about training, you don't just think about training of the lecturers themselves, but you think about the college staff, both the management and the technical team, so that they are also able to support this. So really it's looking at it from an organizational perspective as well as an individual lecture perspective. And I think Aliyu, you'll have more to answer, so you've got your hand up. Why don't I hand over to you?
Yeah, can you hear me?
Aliyu, yeah.
Yes, we can hear you now.
Oh, at last, I've been shouting. Okay, yeah. So for me, we had several challenges which we tried to address to the best of our ability, but I think one of the most interesting ones was the time. This is a project that wants to support colleges to create digital resources within 1 year. And I think the solution was to actually think of the sustainability right from the beginning of the project. So when we started, we know that this project is 1 year. So we don't even consider as the implementers. We consider the colleges the implementers. Ours is to provide them with all the technical support they need. And whether the project ends, the colleges are the implementers, you'll just continue doing what they have already started. So we're there to provide them with all the technical support they need. Another challenge, of course, was the one of training is not enough. We have to come up with reference videos. We have to come up with online materials, technical support to ensure that, not only that they are trained, but we're able to build their confidence so that they can go down and not train others. and also continue creating digital resources. Lastly is the engagement of the students. I wouldn't call it a challenge, but an opportunity. We realize that students have a lot to play, as Tim also said, and we consider students as active participants in creating the digital resources and use. We have colleges that are working closely with the students in creating digital resources that they can use to sensitize their colleagues on how to use the e-learning system, on JC, on school activities. So because of time, I think I'll stop here. But we have a lot of challenges and a lot of...
Yeah, we have, yeah. So I have seen Hadiza, Khalid, who else? Please. Hadiza. Okay, Dr. Emmanuel is back now. But let's hear from Hadiza, Khalid, and Dr. Emmanuel. I know, so I'm going to take 5 minutes of your time to round up this. Hadiza, can you hear us? I don't know why we're having difficulty getting people to talk. Khalid, can you talk? So between the three of you, between Khalid,
hello,
Hadiza, whoever
hello,
can talk now, and Dr.
hello,
Emmanuel. Yes, Khalid.
Yes,
I see Musa Ibrahim
good morning,
also wants to talk. Good evening.
Thank you for the opportunity. Yes, I think everybody, all the speakers have done well. I'm just trying to look at the aspect of attitude. Is one of the challenge. You know, some of the lecturers, they have kind of a background issue on digital and computer. So, but one of the solutions we've created was to kind of support them with confidence, and that's really helpful. So I think it's a gradual thing, especially if to say you change from a method you are doing to a new method. So it's a kind of a shift. So that tends to be kind of a difficult to the lecturers, which I think they need to be taken kind of gradual for that shift. So that's just my point. Thank you.
Thank you.
Hello.
Who can talk now? Because
Hello.
now Dr. Emmanuel, Hadiza, you can talk now. Okay.
Yes,
Hadiza.
Yes, thank you so much. Thank you, Helen. Appreciation to all our partners. On the side of institutions, I want to speak that success stories are more than the challenges. Because we have achieved a lot, our capacity has been built. But the lessons learned from these projects, and particularly for the digital resource creation, we learned that there shall be a continuous utilization for you to perfect yourself. So in that regard, we are calling for the project. And I know that you have been doing, whenever we have technical support as part of our sustainability, we want to call on you. Because what it takes, if you practice, particularly for the OBS of CapCut, if you live it for a longer time, what we want to do is that you are doing a refresher. So the lessons that we've learned with the success is there must be a continuous utilization. The second aspect, I think, our students are also around, and I think one of them have a question that I want to ask. But I'll also, before we ask, I want to ask that we have planned a lesson that we need to integrate the students, and the students, they are the one at the receiving end. So of course, if there are ways, or maybe in the project or any other technical support, if we can make it extended to all the students, and then trying to see sustainability, so that when the students take it as their responsibility, then their peers also look at it very responsible. This is the student telling us how to do this, the e-learning, this and that and that. So integrating the students, we find out that, just like Aliyu have said, and Mama, and I think that we need to look at this aspect. Thank you so much. We sincerely appreciate it, and we hope we will continue to work together. Thank you.
Thank you. Thank you very much. Dr. Emmanuel. Dr. Emmanuel, still? You still have challenge? Okay. Who else? Musa Ibrahim. Catherine, what's, I hope it's not, are they free?
So I can allow mics, but everyone needs to unmute their side.
You need to unmute yourself. Whoever can talk. Because if you don't mind, I say borrow me your 5 minutes. I want to round up in 5 minutes. So who can speak?
Everyone.
Good afternoon.
Yes, hello, ma.
Hello, I can hear you, Musa.
My name is Musa Ibrahim, a student of Shawsile College of Nursing Sciences, Damaturu University. Ma, we have a platform where we can select a topic that is difficult for students.
Yeah, I'm with Dr. Emmanuel now.
To understand.
No, so let him wait. Somebody is talking.
Okay.
So, ma,
continue,
we have a
Musa.
in our institution that when we consider we look into topics that are difficult for students to understand, we take that topic and simplify it in a video form and share it with our students for easy understanding. And I am a 300 level student, so very soon we are going. So do you have any platform or any avenue that would aid in the sustainability of the platform of the program so that it will be continuous, everybody will be learning? Thank you, ma.
Thank you. That's a big question. So even if the student graduates, how can we continue engaging with them? That's a good question. And that the council I know is also thinking about it, using this up to in-service training. Dr. Emmanuel, over to you.
Thank you. Thank you very much. Sorry, I was muted from my end, so I could not speak. For the in-service training, we already have the modules available. So what we want to do is to, the tenure of the former facilitators will be ending by this year. Around November, thereabout, we're going to have a set of new facilitators. We're going to give them full orientation on all the modules we have, including the student-centered learning module 2. So we're going to train them, and then as they go back to the various states, they're also going to do training for a pool of facilitators. Good enough, we have those who have already been trained, who are available. They will use them as the first cohort to run the mandatory continuing professional development program. So we're hoping that all nurses will be on board. They will be trained as they go for continuing professional updates before the renewal of their license. And then since the educators have been trained, we know that the pre-service has been taken care of. So in the schools, we will continuously update the content in our curricula. So the school area, the pre-service area is covered, but for the in-service, we will use the platform of the mandatory continuing professional development to ensure that all nurses are trained. And of course, we've also agreed at the council level that we'll have another training for council professional officers. And with that training, we'll have a pool at the national. And then with those who have been trained in the zone, we'll give them support and roll out the training in all the regions. And at the regional level, take care of all the states. We are expecting to run this program all over the country so that we can have a national coverage. Apart from just the 7 schools and a few others were added. We'll have a national coverage, and so that everybody will be on board. Thank you very much.
Thank you. Thank you very much. We have just a minute. Binta K. Jibrin, who has raised her hand for a long time. Binta. Can Binta talk?
Yeah, you just need to unmute your side, Binta.
We can't hear. You need to unmute yourself. I can see Binta is talking, but you need to unmute yourself. Okay. Sorry, we can't hear you, Binta. So we have to come to, I have to bring the session to an end, and I would like to invite, we have more questions coming, but unfortunately there is one from Jessica. Are there plans to explore how the digital training has resulted in a change of knowledge? And then maybe, can you read it out for me, Eileen?
Yeah, sure. So Jessica is asking, are there plans to explore how the digital training has resulted in a change of knowledge and then down the line, change in practice among the students? So I think it's looking at measuring impact upon students' learning and practice. Are there any plans for us to measure that?
That's a big question, and I think it's something we can, as partner, we should do, and I think we should do that. So we'll definitely, and it's something we can easily do with low cost assessment. We can do. Yeah, so it's a good idea. There's no such plan, but we'll have that plan, if I can say it that way. Then the next question is, how do we measure the real world impact of this intervention on maternal and child health outcome? I'm not sure of this one, because this requires a very rigorous evaluation, and because that's costly. I wish we can, but yeah. So what do you think, Helen?
So I think, so as we've kind of been mentioned,
one of our M&E, you and Khalid.
Yes, I think as was mentioned earlier, there is a drain of skilled healthcare professionals moving out of Nigeria. I think one of the potential impacts of this project is to increase the number of students who are training, because they are better able to be engaged in their training and complete their training. I think also that as students are able to understand their topics more in depth, they are able to provide increased quality of care for women and children. But I do think it's to be able to identify attributes and causal mechanisms here would be very tricky. But I think we do know that generally that if you have more community and frontline healthcare workers, and with those having greater exposure to knowledge and to techniques and enhanced training, then that does impact positively maternal and child health outcomes generally.
Okay, thank you. I've seen more hands. Do we have the patient to take one or two and we close? One from Hasia, one from Usman. Well, Usman has talked, isn't it? So it's Hasia. Hasia? No. Usman? Can you talk? We have challenge. I think it's the mute.
Yeah.
You're on mute. Okay, over.
All right, Ma. Can you hear me now?
Usman?
Yes.
Yes, Ma. Can you hear me?
Yes.
All right. Thank you very much for the opportunity.
We can hear you.
All right, Ma. Actually, we had quite a number of challenges, but I would like to share my own institution challenges. From my own institution, from our side, is a kind of like teachers' attitude in creating digital content. Actually, they feel reluctant in creating this digital content. We don't know the reason behind it, even though the zonal coordinator from our site, Nursery and Midwifery, he made a little assessment on that, and some they were complaining about already challenges that we have discussed, that is the gadget, the internet access, and the rest. And unfortunately, the student, or I can say fortunately, the student also, they are very interested about the digital content. They will be asking for more content because it's easy the learning activity. But despite these challenges we are facing, but the school management have tried to monitor the little we have to see those lecturers, they are participating, and those who are not participating. No, this is the challenges we have. Is the
Thank you. It's good to hear from you on the ground. Thank you very much for this. Is Asia still there? But otherwise, I will invite Dr. Awal to give a closing remark.
Good morning, everyone.
Is it a vote of thanks or closing remarks? Closing remark. Morning.
Good morning. Can you hear me?
Yeah, we can hear you. Morning.
Okay, thank you very much. As we are concluding the impactful section, I would like to extend our sincere appreciation to all our speakers and participants for your time, attention, and contribution to today's webinar. We have explored, what we have explored goes beyond technology. I want you to know that it is about reshaping the future of nursing education, practice, and leadership, thereby creating a new culture of care driven by innovation, data, and collaboration. We acknowledge with gratitude the support of our funders, FED, GHWP, Ducit Blue Solutions, and other NGOs who have done similar projects in Nigeria or elsewhere. Your investment is laying the foundation for smarter and safer healthcare delivery. Equally, we recognize the leadership of Nursing and Midwifery Council of Nigeria, the Federal Ministry of Health, for shaping the policies that ensure technology strengthens rather than replaces compassionate care at the heart of nursing. To our provost colleges of nursing, lecturers, and students, I want you to know that your commitment and passion remain vital in translating this transformation into everyday practice. As we look to the future, the journey will demand sustained collaboration, openness to change, and bold investment in people. Let us leave this session not only informed, but also inspired to act, innovate, and advocate for a digital-enabled nursing profession. Together, we can turn digital transformation into a powerful reality within Nigerian healthcare system. Thank you once again, and let us continue to build on this momentum. Over to you, Mommy.
Thank you very much with this, and sorry for taking additional 14 minutes of your time. I'm not going to, because I've taken more than enough, so I'm not going to add anything, but it has been a very enriching webinar. And also our journey with Manas Idi Nana, I would like to really express our gratitude as the lead. It has been a very cooperative teamwork with all the 4 partners. Each one of them, as Ali said, bringing a unique talent that really makes a lot of difference. And we want to appreciate, Ali mentioned that the flexibility of our funders. We've been, as we go, we see things to change. You will come back, explain all we need, send an email seeking for approval, we get it, we adjust. And that has been, that adaptive nature of the project has been the really key factor in the success of this project. And we look forward to additional collaboration with really particularly the colleges, of the management of the colleges. Thank you very much. Excellent. The leadership of the council, excellent. we really very proud to be part of this project, this teamwork. Thank you. Bye-bye.